So neurocognitive testing is important. It is a way that we can feel better about our diagnosis of concussion and when we think the brain is healed. Baseline testing is very important, and we would like for all student athletes to get baseline testing. There's an IU grant that will pay for baseline testing in all high school students, and there's several other sponsoring agencies that will do the same. We always repeat the testing after a concussion until it gets back to the baseline or gets back to normal. This is a validated test as accurate measure of brain function. There's multiple peer review articles and research that have been done to validate the test. You can see a list of organizations who use the impact test. It's mandated to be used in the NFL, the National Hockey League, Major League Baseball, IRL, and NASCAR. And it's even given to all the branches of the military, including the Coast Guard, because in war zones they sometimes have similar types of concussions, and this again allows them to know better when the brain is healed. It's been used in over 3,500 high schools and in over 400 colleges and universities. One of the most frequent questions, even the first day that you see the athlete, that they ask is, when can I return to practice or to games? Well, there are some very specific things that have to happen before they can return. One is they have to be symptom-free at rest and have a normal neurological exam. Their neurocognitive testing has to be back to baseline or back to normal. They have to be symptom-free with exertion. They must be seen by a physician trained to treat concussions to be cleared. And the status is determined not by just one of these things, but all of these things have to happen. Signs and symptoms, neurologic exam, and neurocognitive testing. The final decision is at the discretion of the doctor, because he may see something that he just doesn't feel is quite right, even though they've met most of the goals that we've asked them to meet. And we must remember, a concussion isn't here today and gone tomorrow. A typical time to recover from a concussion is 7 to 30 days. This slide represents an actual case where we have a baseline and then a post-concussion test on many occasions. And as you can see, when it's highlighted in dark letters, that means it's still abnormal. So it took 5 post-concussion tests before this athlete's impact test returned to the baseline. And this is routinely how we use the test. Well, what is the goal of medical treatment for concussions? Really, it is for us to try to determine as best we can, using available information and testing, when an athlete has completely recovered from a concussion before allowing that athlete to return to play. You see a slide now that is not always what you see is what you get. For example, if we look here, we see an old lady. Here's her nose, here's her eye, here's her mouth, here's her chin. Or if we look at it in a little different way, we see a nice, beautiful young girl. Here's her eye, here's her nose, here's her ear, here's her necklace. So what you see is not always what you get. And again, if we look at these pictures of 2 athletes, we're trying to determine which one has the injury. Well, it's pretty obvious. The gentleman has got a sling on, so he may have a shoulder injury, an elbow injury, a broken arm, a wrist injury. How about the young girl? She's smiling, beautiful young girl. She looks like she doesn't have a care in the world. Well, actually, she's had a concussion. She's still having a lot of symptoms, and her impact test is still abnormal. So I show you these 2 slides to show you that concussed athletes do not look ill. And because they do not look ill, they have more anxiety from peers, coaches, teachers, and parents because they're constantly saying, well, you look all right. Why aren't you practicing? Why aren't you going out with me? So they have a lot of pressure from all of these people. They do not feel normal, but they're anxious because they cannot do physical or academic activity without developing symptoms. Well, let's talk about treatment while recovering when we're still symptomatic. We need to limit physical and mental activity because in an injured brain they can precipitate or worsen symptoms. So we do that by limiting exertional activity particularly, and that includes no sports drills, practice, or games, no weight training, no physical education classes, and even sometimes when we allow the athlete to go to practice, he may have his symptoms aggravated by the light or the noise or blowing the whistles. So we don't want him to stay if that's the case. We want to get him away from this activity that aggravates his symptoms. How about mental or cognitive activity? Well, many of these athletes are so symptomatic with headache or trouble concentrating, nausea or dizziness that they may miss school because they're not able to go, or they may have limited attendance, for example, maybe half days. The reason we don't want them to go to school is because if they get to school and they have symptoms or they develop symptoms while in class, we want them to leave the class and go to the nurse's office. When they're able to go back to school, we're going to give them what we call academic accommodations that will allow them to stay in school but not work as hard as they normally would. So we give them more time to complete assignments, no time tests or quizzes, pre-printed class notes, because although they may be able to sit and listen to the teacher teach, if they try to take notes, that multitasking may be enough to create symptoms. And we want to limit their homework. The other things that just kills the athletes when we tell them about this restriction is limiting texting, particularly for the girls. We limit video games, and that usually really excites the guys. We also limit watching TV and surfing the internet. All of these activities take fairly high brain activity, so they often cause symptoms. Once they're back at school, they have often missed school, and so they have assignments that they have to make up or tests that they have to make up. And we like to hold up the makeup work until their symptoms are gone. Now, what we like to do as we get them back into their normal activity is to do that gradually. That's what we call activity progression program. So from an academic standpoint, we may start to wean some of their academic accommodations. For example, we may start letting them take their own notes rather than have pre-printed class notes, and gradually allow them to take timed tests or quizzes. We would like for them to be able to handle the daily work that they have for each day of school for over a week before they start to make up work, tests, or quizzes. We may have to postpone semester or end of the year finals, papers, or projects until the brain is healed. So they may have to do those projects or those tests during the Christmas vacation if it's at mid-year, or during the summer. Let's get back to that question about when can the athlete return to play. Athletes must satisfactorily complete all 3 phases of treatment with no symptoms and normal neurocognitive testing. So, no symptoms at rest, no symptoms with exertion, and their neurocognitive test is back to baseline or back to normal. There are no standard time limits anymore before athletes can return to play after a concussion. In the past, before we had neurocognitive testing, we had an arbitrary time that we would keep them out before they returned. We may have been sending some of those athletes back before their brain was healed. We must remember that an athlete that has a concussion is at increased risk for another concussion. Now, there's some more serious consequences from concussions. And if an athlete is having persistent symptoms for 6 weeks or more, not healed up, we worry about them having what we call a post-concussion syndrome. And the things that they complain about with the post-concussion syndrome is persistent headache, dizziness, emotional lability, trouble concentrating, or depression. We have taken an athlete that's very motivated to participate, to win, to be with his team members, to work out. And often, they're very intense in their academic activity as well, and they don't want to get behind. So we've taken away all their physical activity, not let them participate in practice or in games, and they've gotten behind in school because we've limited their cognitive activity at school. This often causes fairly significant depression. And then they just get in this vicious cycle where they don't get better, they get more depressed. So that may require that they see a psychiatrist and may require that they be on strong antidepressant medication. So our job is to recognize the concussion early, get them out of harm's way, and treat them the best we can to help reduce the incidence of getting this post-concussion syndrome. An even more serious consequence can be what we call the second impact syndrome. And this is an athlete that has an initial concussion, and for one reason or another, he's still having symptoms, he doesn't tell anybody about it, or his symptoms are gone, but his impact test may still be abnormal. Instead of staying out of practice or games, he returns. He may have a very minor head injury. He may just trip and fall and slightly bump his head. And this can cause brain death from tremendous swelling in a young athlete's brain. Brain death is a scary thing. It does not happen very often. There's only been about 40 cases reported. As you recall earlier, we talked about there being 400,000 sports concussions in the U.S. each year. So this would be a very rare thing to happen, but you don't want your child to be one of those statistics.